House Bill 283, Maryland Medical Assistance Program, Gender Affirming Treatment, Trans Health Equity Act. Favor report is amended, adopted. Amendment number 1.
Recognize the gentleman who asked for delay.
Thank you, Madam Speaker. I appreciate the opportunity yesterday to have laid this bill over so that the members could read the bill. I don't know if the committee has had an opportunity to review the amendment. Maybe I can yield to them first before I continue.
Committee Chair.
Thank you, Madam Speaker, and good morning, everyone. Thank you for the courtesy. The committee has had an opportunity to review it, and the floor leader is ready to address it when you're ready. Thank you. Thank you, Madam Speaker.
Thank you.
Thank you, Madam Speaker. Then, if I may, Madam Speaker, I would like to ask the floor leader some questions.
Floor leader.
Thank you, Madam Speaker.
Good morning. Has the amendment been considered, accepted, or rejected?
The amendment has been considered and has been rejected.
Okay, so under current, some questions then, if I may. Under current Medicaid requirements in Comar in Maryland, it says that services can be provided to individuals 18 years of age and older. This bill, I think you have indicated previously in the voting session, was going to codify Comar, but it doesn't include the 18 and older. So does this bill then apply to children?
Currently, Medicaid provides some gender-affirming care for children. So that already is happening. What's not happening is a number of different services that particularly apply to adults are not being offered.
Okay. So would one of those, thank you for that, would one of those, and I'm reading from the gender transition services under the Maryland Medicaid program, it says here, the individual is at least 18 years of age, and the individual has capacity to make fully informed decisions and consent for treatment. That's currently in Comar, and I'm reading directly from the document.
You are reading directly from the document. We do have information from the Medicaid office that gender-affirming care is being offered to children.
So is a vaginectomy offered to children in Maryland, and would this bill allow that?
No.
That's not so, because it says it right here. If we're eliminating the 18 years of age requirement, which that's what this bill does, then from a female to male transition of a child, a vaginectomy would be permitted because we're removing the 18 years of age requirement.
So let me back up just a bit around how these decisions are made.
Can I ask you a question, though? What is a vaginectomy?
Can I answer? I'm going to answer your question, but I need for the body to understand, because out of context, the answer sounds different than what the true spirit and intent is. So the context is the decisions about what medically necessary and medically indicated gender-affirming care is appropriate at any point after the gender dysphoria diagnosis is made by, if the person is under 18, it's made by the patient. The parent is required. The parent is a required part of this process, and the medical provider. So in those rare, extremely rare circumstances where the patient, the parent, and the medical provider believe that it might be necessary, medically, not believe, know that it's medically necessary and indicated to proceed with surgery, then they will make the decision to do that. That's what this bill allows.
So this bill, House Bill 283, would allow a vaginectomy, and I'm going to ask again, what is a vaginectomy of children I'm talking about? Because we're removing the 18 years of age and older requirement.
It's not something that we would do in children.
But
Unless there was cancer or some other medical condition that would cause that.
That's not, I'm sorry, but that's not so. Under the Maryland Medicaid program, and this bill specifically states that it would apply to people under the age of 18, which are children, and here are the services, and those services can and shall be provided pursuant to all of the things that you just said, one of them being a vaginectomy.
So I'm going to go back to medically necessary, indicated, and consistent with the standards of care. This is not in any way, a decision that is being made impulsively.
So a male to female transition, there is the belief by certainly those who have put their names behind House Bill 283. I just want to be clear that children are capable of making the decisions to have male or female transition for a vaginectomy, a hysterectomy, a mastectomy, an ovurectomy. If any of these items were truly medically necessary, they would be done for the health of the individual. But that's not what the purpose of this is. This is not about health. This is about male to female transition and female to male transition of children. So what is a vaginectomy?
It's a removal of the vagina.
Of a child.
We're not talking about children, though. We are talking about, and I just need to go back to, no child, this bill in no way says that a child can make an independent decision about what kind of care they need, including gender-affirming surgery.
In the bill it says, and I'm reading from the bill, alterations to the genitals and gonads, laser treatment for scars and gender-affirming treatment, alterations to the abdomen, chest, trunk, and buttocks. And it just goes on and on. This is from the bill.
Right.
The bill matches the gender transition services under the Maryland Medicaid program, which includes a vaginectomy, which the bill clearly says would be something that could be done at taxpayer expense for children under the ages of 18. So what is a vaginectomy, since that is in the bill?
So the bill is allowing it under the extreme circumstances. Just because it's in the bill doesn't mean it's going to be done. That's number one. But number two, I'm just going to go back to, and you're going to, I think, get tired of hearing me say, medically necessary and indicated for the health of the individual. I disagree with you, sir, when you said this is not about health. This is absolutely about health. And yesterday, you referenced that this is a very serious bill. I totally agree with you that this is a very serious bill. It is especially serious for the 6,000 transgender people on Medicaid who do not have the available services currently available to them under our Medicaid program, when people who can afford commercial insurance have all of those options available to them to make themselves healthy and whole.
And those 6,000 people are over 18. They're 18 years of age or older. We're talking about children here, and I really want to keep the focus to that because that's what this bill is. This bill is applying what adults are doing to themselves, and they are adults, and they get to make those decisions because they are adults, to children. Among other things, a palloplasty, and I could very well be saying it wrong, scrotoplasty, a placement of testicular prostheses, mastectomy, children, male to female transition, a penectomy, a clitoroplasty, a labioplasty, a vaginoplasty, and it's further my understanding that it would also include puberty blockers for children. Is that so?
Puberty blockers are currently used
Not on
by
children.
Medicaid. Yes, they are.
Not for transitioning. So it says here hormone therapy, hormone blockers, and puberty blockers, which is the dead giveaway that it's for children. So my question is, isn't it so that there is an enormous loss of bone capacity and bone density as a result of putting children on puberty blockers?
The answer, sir, I'm being told, and the research says no, that's not true.
So there is an enormous amount of research and data, and it is indeed so that by putting children on these drugs, we are ruining their bone density. And I have the data here. I'm not going to read it because we can all read data, but it is so.
Okay. So, like many medications that we take, it may affect bone density, but if the medical provider who has prescribed, based on medical necessity and indication, the puberty blocker, then they would also supplement it with vitamin D and other supplements that would counteract that impact.
And I appreciate this, Madam Speaker. I do. I just have, I think, 2 more questions, and there are some others that do as well. Can you please tell me what a penectomy is?
It's right. It's the removal of the penis.
Of children.
Pardon?
Of children.
It is not specific to children.
The bill is. So can any of these, can
No.
that be reversed?
She answered your question.
Can this be reversed?
A penectomy?
Well, a child.
Yes. It is possible to do that, yes, to reverse that.
You can reverse it.
Yes.
So the removal of a penis can be, but it can be reversed, I presume, with what?
So surgeons currently reconstruct penises all the time for folks who identify as male and want to have that organ,
And this
or if it was damaged in some way. So yes, it is possible.
And so they're using cadaver penises. Is that so?
No.
That's not my understanding. So there are some other questions, Madam Speaker, and it's a serious matter, and I hear a lot of chatter, and it's an important issue to us. So I think that the members should listen closely.
Madam
Thank you.
Speaker, may
Yes.
I ask, is
Good.
the gentleman
Vice Chair.
moving his amendment?
Yes, the gentleman is moving his amendment, but there are a lot of other members in the caucus who do want to speak on this and the amendment and to ask you questions. And I do appreciate your patience. Thank you.
Okay,
And
thank
the
you.
chairman's patience as well.
Anyone else on the amendment has been discussed? Yes, go ahead.
Thank you, Madam Speaker. And could the floor leader please rise for some questions?
Vice
Perhaps
Chair
I should
Committee?
just stay up.
So I think you know me as a colleague, and when I stand, I've tried to be prepared, and I want to have a brief yet informative discussion for my purposes. And you know, one of the things that I think happens when we have these debates on the House floor is a opportunity to learn more. And I want to tell you that what I'm getting ready to do and the questions I'm going to ask are built through the lens of I wasn't going to stand on this bill yesterday, but because of the laying over procedure, it granted me the opportunity to print out the entirety of the bill file and to understand where it's coming from for the purpose of me having some concerns. So on the amendment, I pulled the study that was in your file, Gender Affirmative Care, a data-driven review of relevant academic literature. It was written by the University of Maryland, University of Kentucky, University of Amsterdam, University of Edinburgh. And the first question that I have for you goes to one of the early statements they make in this 70-some page document, which is that the Maryland and Ohio testimony, so on 2 different states, similar bill subjects, they say that the majority of witnesses for each state took opposite stances on gender affirmative care. So in Ohio, where they're trying to move restrictive legislation, they got a lot of anti-witness testimony that was in support of Ohio's position. And in Maryland, we had 95% of pro testimony on this subject, for which there was 4.5% against. And so what they're saying, The reasons for this are likely that the Maryland General Assembly is a supermajority Democratic body, and 2, witnesses were probably more inclined to submit testimony that aligned in substance with their personal positions on GAC. So to my question, since this is a highly partisan issue, witnesses who would not want to increase access to gender affirmative care may be discouraged from testifying in a majority Democrat legislature, and they will admit vice versa in Ohio. And the question I have for you and the committee is, do you feel that you had enough testimony for and against as you were advancing this policy when you have amendments like the one that we have here, which is a simple one, that's saying anybody under the age of 18 should not be access to this care? The question to the committee is, do you feel like you either solicited the kind of testimony that would help you have a better work product, or do you believe, as the report is suggesting, is that because it's a supermajority here in Maryland of the Democrat Party, that you won't find the kind of opposite testimony because it's so partisan, and this is a difficult subject matter to discuss?
Thank you for that question, and thank you for being a good friend, Delegate. So we are living in a wonderful age of technology when every bill that we are considering is available to the public. They can go online, they can see the text of the bill, they can they can offer testimony. All of the directions for how you offer testimony are posted on the website. We have in our committee many people who come to testify either in person or with written testimony. I would expect that minority legislators who are concerned that enough voices are not being heard can encourage their constituents to come to the hearing, to send us information that they think is important in formulating our opinion about the bill and in our voting decisions. So I think the process allows for great public engagement. And we in no way discourage people. I mean, our chair is in my opinion, the most welcoming chair I've ever met in terms of just making everyone feel welcome. So I think that I would disagree with you that it is simply because of the makeup of this body that we didn't hear. And it's not really related to the amendment. So
thank you, because I believe the same as you, that your committee chair is thoughtful and considerate. But back to the point, the position was not mine. It was one that the study, which was a pro study for this piece of legislation, identified. So the second question on this same study is that those who and this is 13% of the witnesses who either currently or previously identified as transgender, opposed expanding access to gender affirmative care. So what they're saying is that there is a large percentage, and 13%, that's 13 out of 100, who are or were transgender, are opposed to expanding this access to care. And I'm curious how you respond to that, as this is a work product, that surely this report was part of your deliberations. Did you incorporate that 13% and try to understand why somebody who's pro-transgender either was or is, but was against the principles of this bill?
Before you answer, is this on the amendment?
Of course it is.
This amendment is on, that's currently
Madam
on the
Speaker, I started by saying I'm trying to have a reasonable conversation on a difficult subject, and I am headed somewhere. And
But is it on this amendment that
because the report goes
from Calvert?
The report's going to position my concerns and why the amendment should pass, because the report does discuss under 18. So back to my question.
But did you answer my question, though?
I did, but I'd like to have that answer.
Is it on this amendment?
It is.
How is it on this amendment? It seemed like you were going all over the place.
So when we talk to pro-transgender, Madam Speaker, so as we talk to pro-transgender or have been transgender who are opposed to expanding this access to care. I'm simply suggesting that those voices need to be heard, one, and then two, they do in this report, a 70-some page report, speak to the concern with children and access to this sort of care. So the question, Madam Speaker, does speak to this under the age of 18. And I'll be glad once she answers the question to go right to the study and why they have this issue and how they review the report.
So, first of all, we cannot know how people made those decisions about their care when they made them. And, we hope one of the things we want to do with this bill is provide all of the options and all of the information so that people who are looking for medically necessary and indicated health care are making the best decisions for themselves. And that's really important. But I want to be really clear about who is supporting this legislation. And I'm just gonna go down the line. It's the American Medical Association, the American Academy of Pediatrics, let me say that again, the American Academy of Pediatrics, the American Psychiatric Association, the American Psychological Association, the American Public Health Association, the American College of Physicians, the American Academy of Dermatology, the American College Health Association, American Heart Association, American Osteopathic Association, American Academy of Family Physicians, American Society of Plastic Surgeons, American College of Obstetricians and Gynecologists, the Endocrine Society, American Academy of Nursing, American Academy Physician Assistants, American College of Nurse Midwives, American Counseling Association, American Medical Student Association, the Health Professionals Advancing LGBTQ Equality, American Nurses Association, National Association of Social Workers, National Association of Nurse Practitioners, the American Academy of Child and Adolescent Psychiatry. Let me say that one again. American Association of Child and Adolescent Psychiatry, National Commission on Correctional Health Care, Pediatric Endocrine Society, Society for Adolescent Health and Medicine, World Professional Association of Transgender Health, World Medical Association. And let's talk about folks right here in our state. So all of those folks are national, but right here in our state, Johns Hopkins Medicine Association for Transgender Health, the American College of Obstetrician and Gynecologists, the Chase Braxton Healthcare, Planned Parenthood, Healthcare for the Homeless, Johns Hopkins University Gertrude Stein Society, Mental Health Association of Maryland. I've got another whole page full, and I won't subject the body to it. But these are the people who are supporting this essential and medically necessary health care.
But on the amendment, they don't support under the age of 18. So to the speakers.
Yes, they do, sir. I'm sorry. I'm sorry to interrupt, but yes, they do.
Surgery. Do they support surgeries for under the age of 18?
When medically necessary and indicated, and in consultation and consent of patient, parent, and provider.
All right, so to the speaker's point, and the reason why I'm bringing up the report, which I've not heard you suggest that this report's wrong or inaccurate or delivering data that's not valuable to the committee. When asked on written testimony the question of capability of a trans youth to provide informed consent, 27 people or 27 versions of written testimony between Maryland and Ohio were against this position, and only 4 were for it. So the question is, how does the committee, and this is an honest question, what does the committee say when the vast majority of testimony seems to be against the capability of trans youth to provide informed consent?
We are looking at the being consistent with the standards of care, and giving the providers and the patient and the parent all of the information, and it is informed consent. This does not happen none of the gender-affirming care happens without informed consent.
And so, Madam Speaker, the last one, and I'll just speak to the bill. The same report talks about the satisfaction, regret, and the reversibility of gender affirmative care, which I believe that the bill or the amendment sponsor spoke to. The reason why the report's important and why I wanted to spend a few minutes talking about that is because I had the opportunity when this bill was laid over to pull the entire bill file to understand where would I stand on a bill like this. I don't know where I would have voted, to be honest with you, had we not done that. And the report is instructive because it demonstrates that there's not consensus on the subject to the amendment, meaning that there's not consensus on whether folks under the age of 18 should be having the surgery done, and frankly, even if they're in a position to be able to make that decision for themselves, one could easily argue that a child who's growing up and is going through cycles of what it means to be an adolescent has a change of heart. And when you have surgeries, when you have procedures, when you're taking medicine that are aimed at changing who you are as a adolescent, this has to be something that can't just be a vote yes or no on. I think we should, as a legislature, with respect to the Speaker and to this legislature, consider whether or not somebody under the age of 18 should have this available. I saw the committee voting session on this. I don't think I'm the only one in the Republican Party that feels this strongly convicted concern for the children in this respect. These aren't the subjects that I normally stand on, and so for me to stand on a subject out of my jurisdiction, I do so because any Marylander who saw this debate and thought about this discussion would, I think, have the same opinion that I'm carrying, which is I understand why someone who under the age of 18 may or may not want or need the surgery, but we don't believe, Madam Speaker, that the science is settled on this, and I would ask that the body move the amendment, pass the bill, and pursue the subject in future years where maybe you have better discussions and incorporate some of the learning lessons of a 70-page report, of one of which was written by the University of Maryland. Thank you, Madam Speaker.
Madam Speaker.
The floor leader.
Thank you, Madam Speaker. So he mentioned the amendment. May I speak to the amendment?
Yes.
Thank you. I would ask the body to resist this amendment. There are several reasons. First of all, sometimes gender dysphoria is recognized in children. And let me give you the definition of gender dysphoria. And please note, it's a medical diagnosis. Right? So we are talking about health care here. So gender dysphoria is a clinically significant distress resulting from a marked incongruence between one's experienced gender. So who the person believes they are as in terms of who, their own gender identity, and assigned gender. So that's the outward presentation of the biological sex, lasting at least 6 months. This is the definition that is offered by the American Psychiatry Association. And so if this is what's happening, if the child is diagnosed with gender dysphoria, or the person is diagnosed with gender dysphoria, then they begin to consider what their treatment options are. But so why don't we just say over 18? Well, I just said some of this happens before they're 18. They need help before then, and those options need to be available to them. And by those options, I am talking about a range of treatments. And surgical treatment is way down the line from where they begin and takes and it happens over a number of years. I'd want to also say that there are a number of medical professional organizations that oppose adding the age 18 to the law. And they include the American Medical Association, the American Psychological Association, again, the American Academy of Pediatrics. These are the people that we take our children to and that we trust with their medical care. And the American Academy of Child and Adolescent Psychiatry. We need to start treating them as soon as it is diagnosed. Sometimes life-saving treatment. So that's, the background. But the most cogent reason for not putting this in the law is we as legislators should not be in the business of dictating medically necessary care for any individual. This is a decision, medical care and health care is a decision between an individual and their healthcare provider. By putting limits, any kind of limits in this bill, we are dictating what they can do. And it's not, if we don't want to impose ourselves into an individual case by case, let me say that again, case by case, each person has a different manifestation. If you've seen, somebody once said to me, if you've seen one case of breast cancer, you've seen one case of breast cancer, because it is an individual analysis, diagnosis, presentation. So we need to make sure that we are not trying to mandate and dictate what they can, what the patient, the parent, if they're under 18, and the provider can do in order to help these individuals be healthy. So I would, and children who are on Medicaid. So those are some of our poorest children. Some of their parents are making less than $20,000 a year. Try living on that in Maryland. And they're now being denied the important medical care, or could be denied the important medical care that they need if we were to limit this with this amendment. So I would ask the body to reject the amendment.
Madam Speaker.
Gentlelady from Hartford.
Thank you, Madam Speaker. I really appreciate the dialogue today. I appreciate both the chair and the vice chair and their candor, and I know many of us feel deeply about this issue, so I'm going to just share a few of my thoughts and why I think this amendment is so important. I agree with what the vice chair said on how these are the most vulnerable children. They're also the ones that are going to be the least likely to be able to protect themselves from bad medical treatments. And so it is our duty as a body to make sure that we are standing vigilantly to make sure that what they're getting is actually evidence-based care. To touch on a few of the points, the list that was read of all of the people who currently profiteer off of doing this to children, I think was a really good lesson in groupthink. But I would like to address specifically what other places around the world are doing, including many nations that we are very familiar with. So I'll just go ahead and read you a few of the updates to policies for some of these countries. Sweden, in 2022, they deemed that there was a continued lack of reliable scientific evidence concerning the efficacy and safety of both puberty-blocking treatments and other types of hormone treatments for minors. Britain, the UK, evidence on the appropriate management of children and young people with gender incongruence and dysphoria is inconclusive both nationally and internationally. That was also 2022. In fact, in the UK, there was litigation on this matter. There was a very popular gender transitioning clinic called Tavistock. This went through the high courts in England. All of the relevant evidence, scientific-based evidence, was brought forward, and they ended up shutting down not only Tavistock, but also banning the use of puberty blockers in children because it causes detrimental long-term health effects, and the majority of children change their mind when they're given time to develop. Finland just recently banned it. The first-line treatment for gender dysphoria is psychological and social support, as necessary psychotherapy and treatment of possible comorbidities and psychiatric disorders. They completely oppose putting hormones into children whose brains are still developing. And the studies go on and on. I mean, I've got 20 studies here that talk about the risks to children and the lack of evidence, including studies that discuss no impact, no reduction in suicide attempts at any step in the process of cross-sex medical intervention. No reduction in suicide. In fact, a 2015 study found that being in the process of cross-sex medical treatment was associated with a 3-fold increase in suicide attempts. A 3-fold increase. That one is from 2015. So there is a lot of research that shows that the U.S. policy on this issue is going in the absolute wrong direction from the rest of the world. In 1888, the first lobotomy was performed. We failed to ban that, and it continued until 1967. The last person that got one died. Many, many lives could have been saved if we had stepped in as a body and said, this is bad science, it's not based on any evidence, and it's killing people for absolutely no reason. So it's incredibly important that we consider the damages that we're doing and that research is going the opposite direction in every other place except for apparently the few trade organizations who are literally making money off of it. Those are my main concerns, body. I am sure that you can share them with me, but I'll just finish with this quote from our own FDA on this issue, if I can find it in the stacks of research that I have here. Our FDA, quote, "These hormone puberty blockers have been FDA approved only for the treatment of precocious puberty, not gender dysphoria in pediatric patients. They are not approved for halting normally timed puberty, and they are considered experimental." We are allowing experimental gender treatment of children in our state already for those who are private paying. But we are about to allow the poorest among us, who are the least likely to be able to fight back against this, to do the exact same thing. So I am asking you, please, body, support this amendment, protect those children, because if they are 18 and they want to make these changes, it is one thing. But if they are under the age of 18 and their bodies are still developing, you are permanently altering what they are ever going to be capable of. And many, many of these children grow out of this. Many, many, the vast majority. So with that, Madam Speaker, I would support this amendment.
Madam Floor Leader.
So this didn't have to do quite as much with 18 as I thought it might, but I just wanted the opportunity to respond. Sweden continues to offer gender-affirming care and continues to offer it to adolescents. The United Kingdom continues to offer gender-affirming care. The litigation case that the good delegate told us about was overturned, and in fact, the center, the reason it closed, if you look at the reports from BBC, the reason the center closed is it was overutilized. They could not meet the need. So what the UK decided to do was to put gender-affirming care centers in different regions, so they made it more accessible. Finland continues to offer gender-affirming care. The study that I think the good delegate was referring to that said that there was no reduction in suicide prevention after being, or reduction in suicides after being given gender-affirming care. Well, the author himself said that you can't draw any conclusions from his study because he didn't study transgender people before and after gender-affirming care. He studied folks who had transitioned opposed to the general population. So it's not, you're comparing apples to apples, and you're not getting a fair number, and the author of the study said that. So back to 18, 98% of the adolescents who begin gender-affirming care prior to adolescence continue it throughout their life. And remember, there's a range of services, and not every person will choose all of the options available to them. They're going to choose the ones that the individual, believes are most effective for them to self-actualize in their own gender identity, with the support of a medical professional or many medical professionals. I do want to respond to the concern about that was raised about the puberty blockers, and the fact that the FDA said what they were branded for, what they were labeled for, but this is an off-label use of the puberty blockers, and is in off-label uses are determined within the context of the standards of practice. And I'm being told that 20% of medications given to children are off-label. I'm not talking just about puberty blockers, I'm talking about all medication. So and there's been a lot of study on whether or not these, they work for children, and we've determined puberty blockers have been used for almost 50 years. And they've been used safely and effectively. And for folks who are wondering here what happens if the child, and I go back to the good delegate who said, some change their mind, which is why the definitions say that the condition, the distress that the individual is experiencing has to last at least 6 months. And if they're in a gender-affirming care program, there will be a minimum of a year before they can go to the next level. So again, it is a long-term process. And puberty blockers are, contrary to some articles out there, are totally reversible. Once the individual stops taking them, their normal pituitary gland kicks in, and they go back to being the biological sex that they were assigned. So with that, Madam Speaker, ask the body to reject the amendment.
Madam Speaker.
Gentlelady from Hartford.
Thank you very much, Madam Speaker. So I have here a 2011 study, a 2014 study, a 2015, 17, another 2020, 2020 again, 2020 again, 2021, 22, 22, 22, 22. All of those studies say it does not decrease the risk of suicide. It is not one study. It is not one guy. It is many, many, many studies and many, many, many people. And I will just read for the body what the British National Institute of Health said in 2022. Evidence on the appropriate management of children and young people with gender incongruence and dysphoria is inconclusive both nationally and internationally. And I will just remind the body that in Finland, for example, they suggest psychotherapy and that no hormones should be given to children who are still maturing mentally. So this is not a one-off guy. This is not a one-off study. If any of you would like copies of these studies, I am happy to give them to you. You are welcome to reach out to my office, and I will share them with you. And finally, I will just talk for a moment on the subject of easy reversibility. The Royal Osteoporosis Society states quite clearly that you are at a significantly increased risk of osteoporosis if you are taking cross-sex hormones. Have hormones been used for many years? Of course they have. They're used for children with precocious puberty. That means children who enter puberty too early, and they're given these hormones to hold it for a little longer so that they can wait until their body catches up. It's not been given for 50 years to change someone's gender. And in fact, what used to happen with gender dysphoria is that they would give the child their own gender's hormones. That's what they used to do. So this is fairly new. I think the first ever case was 1983 that they tried, and it wasn't very popular even then. So in addition, I just want to say that there is a lot of research into the harm of puberty blockers, and I know another member has done a lot more research and is a medical professional and will probably be addressing that. But this is not a fringe thing. Many, many, many countries are going the opposite direction. France, Australia, New Zealand have all started prioritizing non-invasive treatments and psychotherapy over puberty blockers and other forms of damaging treatments for children because it is so hard to reverse them and it's not helping them. It's not changing their outcomes of suicide. So there really is no reason for us to allow our children to be experimented on. Thank you, Madam Speaker.
Gentlelady from Frederick.
Thank you, Madam Speaker. If the floor leader is not too tired, would she mind rising for questions? I can talk for a second before you have to answer.
Okay.
I appreciate it. So when I'm down here for these 90 days, and I'm very new at this, the one thing I never want to forget is that every law we pass impacts real people. It impacts our children and our friends and our neighbors, the people we go to church with, synagogue, the people we work with, our community. And so when I'm asking these questions, we are truly just trying to understand and make sure that we know exactly what we are voting on and what the impact will be. And that is what the spirit of these questions are about. And I'm going to try to keep it to the under 18 amendment, okay? So I was a little confused and again, it's about minors having certain procedures, and I'm not going to list them all again. When you said that a minor can't have these procedures, the part of the law where I see that it is the intent of the General Assembly that the program provide gender-affirming treatment to all program recipients for whom gender-affirming treatment is medically necessary, including transgender, non-binary, intersex, two-spirit, and other gender-diverse individuals. Is that where the age piece is listed in the law, or is there another place where the age piece is listed in the law?
There is no age in this law, because what we are doing is making sure that the options are available as deemed medically necessary. And oh, by the way, welcome, Delegate. We're so glad you're here. And
I know we haven't met yet. We officially talked a lot. I'm sad that we're doing it under this, but
no,
I really respect you.
That's our job.
Thank you. So at what age then, so if there's no ages in this, and we know that the program recipients are all ages, right, from birth up, right? At what age could you start gender-affirming care then? If it's not, because my colleague had the amendment for 18, which is what a lot of us believe.
So the standards of care for children begin with psychotherapy and socialization activities, because for the folks, the particularly young who find themselves in a situation where they're experiencing that extreme duress, because when they look in the mirror, they don't really see themselves. And that's a very hard concept for some of us to acknowledge, but it causes them great distress and anxiety. So when it's recognized early, the first interventions are psychotherapy, and that can go on for years. For other decisions are made more closely to adolescence, because, and again, I am going to say it again, it's the patient, it's the parent, it's the medical provider who are making decisions based on medically necessary and indicated. And I need to say really, because I have to, medically necessary means that if you don't do it, the risk to the individual goes up. So that's why it's, we want to make sure that the law specifically says medically necessary and indicated, because we want it to be absolutely, we want to avoid the issues of, that there might be a mistake made. Because we want to make sure that we're providing the right treatment. You may, in adolescence, you may decide to do the puberty blockers or hormones, and then as you age, during adolescence, you may make the only decision you would make about any kind of surgery would be, after lots and lots of discussion of options, gathering all the information, and it would only be done under 18 in very, very rare circumstances where the medical professionals and the parent believe that the child is in danger if they don't. So it's extremely rare, and I think I read the number that in the entire United States, only 300 young people have had gender-affirming surgery.
Okay.
Out of 300,000.
And then
So it's again, we want to take our time with this because we want it to be right.
Right, and I understand that, but as we've seen in rates, the rates are increasing as people who identify as transgender. So those rates may change, and allowing it by law or under 18 may cause some difficulties for people, and that's why my colleague brought the amendment. That's the spirit which he did that. So back to the law, how do you then define and measure clinically significant stress resulting from gender dysphoria? Because that is also written in law.
Okay, so we trust our providers to do that. I am not qualified in any way to make a decision about that. That would be the appropriate provider, the patient, the parent, the psychiatrist, psychologist, counselor. Those are the folks who are going to make that decision.
And I'm so glad to hear you keep mentioning parents. So since we just passed a law in 2021 that allows the 12-year-olds to consent for therapy as an adult without the notification or consent of a parent, and a 16-year-old can receive medications for mental health disorders. And I'm not sure as far as gender dysphoria, it has changed as far as the DSM and exactly where it's categorized. Where does counseling and treatment for gender dysphoria fit into this? Because I heard you say a lot of the 6 months thing. I think most parents are going to want to know, which also speaks to my amendment, would a parent be kept out of helping with these life-altering decisions?
Mm-hmm. The law currently requires that the parent is involved in any kind of gender-affirming treatment.
The new law? The one we're just passing, how it's written.
No, the current law, no children, with the exception of mental health, and the reason those bills passed is because we saw that students were asking for help. I mean, we had youngsters come to our committee and say, we need to be able to see someone, and sometimes, it's what's going on at home, and they feel unsafe but we know that if gender dysphoria becomes an issue, then there would be, they'd have to move up to inclusion of the parent.
Okay, so unequivocally.
Unless they were emancipated, I'm sorry.
Yeah, I understand. Yeah. Yes, definitely understand. So under no circumstances would a parent be excluded from these discussions other than if they are an emancipated minor up until the age of 18.
Correct.
They would be, a parent would have to sign off and be part of that decision.
Right.
I mean, that's huge, and that's very clear. Says there are studies that show that minors cannot truly give informed consent, and that their developing brains and minds that change often may have trouble fully grasping the long-term consequences and decisions. I do want to speak a little bit, and I know there was a lot of when we talked about puberty blockers, and one of the most common, the GnRH, which is the gonadotropin-releasing hormone. Is that one of the most common ones? I'm just speaking to it because this is coming from the Mayo Clinic as far as side effects. This isn't me. This isn't a study making up. This is research from the Mayo Clinic that said that use of GnRH analogs might also have long-term effects on growth spurts, bone growth and density, future fertility, which is huge, depending on when pubertal blockers are started. And then if children with male genitalia begin using these analogs early in puberty, they might not develop enough penile and scrotal skin for certain gender-affirming genital surgical procedures. So, I mean, this is not me. This
No,
is the
no.
Mayo Clinic. Anyone can look that up. So I just want to say there are other studies that are showing that. There are other places that are showing that there are issues with these puberty blockers that are medically reputable institutions.
Right. That, if I may, Delegate, that's why parents are involved in the conversation, and the medical providers are going to be able to mitigate some of the side effects. That's, and they can decide whether or not the risk is worth it for them. But I'm going to go back to the fact that those blockers have been used successfully for 50 years.
Right.
And we have studies that show they definitely support the students' development and mental health.
And I get that, and I don't know if they've been used for as long of time as we're talking about using these, especially if someone's waiting longer and longer until they're closer to 18 to have any kind of surgeries, like you said. So is there a medically agreed upon length of treatment of puberty blocking before switching over to cross hormone? And how long has someone been on puberty blockers and then they did resume the complete normal puberty that you talked about? Like, is there a length of time where that would be?
It is a totally individual case by case, and based on the symptoms of the patient, and also the discussions and information that the family has, and always with an eye to the standards of care.
As it should be.
Right.
Thank you.
Thank you very much.
Thank you very
Delegate.
much. Gentleman from Carroll.
Thank you, Madam Speaker. I just wanted to speak in support of this amendment. I just want to read something I think is important to hear, and it does apply to this amendment, particularly as it relates to children who could potentially receive this treatment. And I know it's been a long discussion, so I'm not going to read this entire article here. Just going to kind of skip around a few excerpts here. So this is an article that just came out published last month, and it was about a biological female who had transitioned to a male and then detransitioned, named Chloe Cole. She was put on puberty blockers and testosterone at age 13, and at age 15 she underwent a double mastectomy. And then at age 16, just a year later, she decided to detransition, and now she's about 18, and so here 2 years later, she's continuing to experience painful side effects from those medical interventions. She reported that the double mastectomy procedure caused fluid to leak. She said that she doesn't know if she'll be able to carry a child to term. And because of the testosterone, she's got permanent changes to her bone structure that cannot be reversed. She has issues with her urinary tract. And because of the mastectomy, she'll never be able to breastfeed. Furthermore, she talked a little bit about how she came to her decision to originally get this surgery and then decide to kind of come back. I said, at this point, I'm far from whole, I'm far from healed, I'm still processing and dealing with what I went through. I've lost all my trust in my healthcare provider and possibly even healthcare. She said she wasn't really allowed any time to just be observed alone without intervention. It was only about half a year in between being diagnosed with gender dysphoria and actually being medicated. So the process for her was very expedited, and there was not really any pushback from any medical professionals, she said. She began to question her identity at the age of 12, and her parents were advised by medical professionals that she would commit suicide if she was not affirmed with medical intervention. And Chloe said, my distraught parents wanted me alive, so they decided to listen to the doctors. And I'll just wrap up with this, because I know it's been long. She said, I've been emotionally and physically damaged and stunted by so-called medical professionals in my most important developmental period. I was butchered by an institution that we must trust more than anything else in our lives. It is not loving to lie to a child. It is not loving to disrupt a child's natural, healthy development or to encourage them to do so. And with that, I urge this body to support this amendment. Thank you.
Madam Speaker.
Maker of the amendment.
Thank you, Madam Speaker. I do want to thank you, Madam Speaker, and the committee chair and the floor leader for allowing this very important debate. I think that's important to say first. To finish, I just wanted to reread the amendment. The program may not provide gender-affirming care to recipients under the age of 18, including puberty blockers, for the treatment of gender dysphoria in order to provide gender confirmation care. That is the amendment. The science is not settled. Without question, the science is not settled. And as such, we do not experiment on children when the science is not settled. Thank you, Madam Speaker.
On the amendment, all in favor signify by saying aye. Oppose? Roll call.
Madam Speaker.
Is everyone out of the lounge?
Madam Speaker,
Yes.
I apologize, my button's not working. No,
And
I've been trying.
is it working now?
It's still not working, Madam Speaker. I've tried 3 times. Oh,
You
now
need
it's
to
working. Thank you.
Okay. Clerk will take the call. The amendment fails.